If you buy something through a link on this page, we may earn a small commission. How this works. Overview: it's not unusual to experience some sweating between the legs, especially during exercise and hot weather. We have many sweat glands located in our nether regions. Sweat stains on the crotch of your yoga pants, however, can be potentially embarrassing. Sweating, or perspiring, helps our body cool itself off. The sweating process involves our metabolism, nervous system, hormones, blood flow, and even our emotions. Sweat that accumulates on your thighs and pools between your legs could indicate a problem, especially if it interferes with your daily life. Here are some possible symptoms of excessive sweating: itching, chapping, irritation, pungent odor. The medical term for excessive sweating not caused by temperature or exercise is hyperhidrosis. It can be hard to tell what's considered a normal amount of sweat and what's considered excessive, especially if don't feel comfortable talking about it. There are certain signs to watch for if you think you may be sweating too much between the legs. You can make an appointment with a doctor to help pinpoint the cause of your excessive sweating and possibly even treat it. Sweating in groin area and inner thighs. For females, the vaginal area contains the apocrine glands. Most women will experience some vaginal sweating due to the presence of these glands. For some women, excessive sweating can indicate a problem. The causes of sweating between the legs in women are varied. You might need to schedule an appointment with a doctor for further evaluation. Some reasons why a woman might have excessive sweating in the groin area and inner thighs include menopause, due to changing hormone levels, low blood sugar, diabetes, which may include night sweats, or nocturnal hyperhidrosis, caused by low blood sugar during the night, pregnancy, due to shifting hormones, hormone imbalance, hyperthyroidism, which may include other symptoms like rapid weight loss, jitteriness, fatigue, and a fast heart rate, a diaphoretic, or sweat-causing medications, including some blood pressure medications, chemotherapy, hormone treatments, and certain antidepressants. Anxiety disorders or stress. A family history of hyperhidrosis, obesity, crotch sweat. For males, men generally sweat more than women, so what's considered excessive sweating in women may actually be normal for men. However, certain conditions can result in excessive sweating that interferes with everyday life. These include low blood sugar, diabetes, hyperthyroidism, which may include other symptoms like rapid weight loss, jitteriness, fatigue, and a fast heart rate, a diaphoretic, or sweat-causing medications, including some blood pressure medications, chemotherapy, hormone treatments, and certain antidepressants. Hormone imbalance. Anxiety disorders or stress. Obesity. Family history of hyperhidrosis. How to control excessive sweating in the groin area. Excessive sweating in the groin area can be managed with a combination of lifestyle changes and medical treatments. For men, things you can try at home. Wear underwear made of natural materials, such as cotton or moisture-wicking fabrics. Wear loose-fitting boxers. Shower twice daily. Apply cornstarch to help control moisture and odor. Avoid spicy foods, caffeine, and alcohol. Try relaxation strategies, like yoga or meditation, to reduce stress levels. Depending on the cause, a doctor may also recommend medical treatments for treating excessive sweating, including prescription antiperspirant with aluminum chloride, Botox injections to block the nerves that stimulate your sweat glands, anticholinergic drugs, such as glycopyrrolate, robenal surgery to block nerves that cause sweating, which is typically only suggested after trying other treatments since a sweaty groin is prone to fungal infections like jock itch. Ask your doctor for a prescription antifungal powder to reduce your risk of infections. For women, things to try at home for reducing sweat in the groin area include: avoid tight-fitting synthetic underwear, pantyhose, tights, and yoga pants. Wear underwear made from materials that breathe, like cotton or moisture-wicking fabrics. Use cornstarch to help control moisture and odor. Bathe twice daily. Trim back pubic hair. Use an antiperspirant between the legs, but avoid sensitive skin on the vulva and mucous membranes. Reduce stress with yoga, breathing exercises, or meditation. Avoid spicy foods, caffeine, and alcohol. A sweaty groin may also lead to yeast infections. Ask your doctor or head to the drugstore for an antifungal cream, ointment, tablet, or suppository if you think you have a yeast infection. Medical options for excessive sweating include hormone replacement therapy, HRT, for hot flashes during menopause, prescription antiperspirant with aluminum chloride, Botox injections to block the nerves that stimulate your sweat glands, anticholinergic drugs like glycopyrrolate, Robenil, hormonal birth control to regulate menstrual cycle, surgery to block nerves that cause sweating, which is typically only suggested after trying other treatments. When to see a doctor, it's important to see a healthcare provider to rule out possible conditions. Women may want to seek medical attention for sweating in the groin area and inner thighs if they get repeated yeast infections. Shave repeated cases of bacterial vaginosis. Notice a strong vaginal odor, fishy, yeast, or musty smell, and thick discharge. Have inflammation, swelling, and pain in the vulva. Have sweating that suddenly increase. Notice excessive sweat in other parts of the body. Sweating alongside other symptoms. Experience emotional complications, like anxiety in social settings. Because of sweating, men naturally tend to sweat more than women, but there are still a few signs that the sweating could be a cause for concern. Men may want to see a doctor for sweating if they have a flaky and scaly rash on the genitals, inner thighs, and buttocks. Feel a burning sensation around the scrotum and penis-shaped testicles that are excessively itchy. Sweat excessively in other parts of the body. Sweating alongside other symptoms. Shave sweating that increases suddenly. Notice a change in body odor. Experience emotional complications, like anxiety in social settings. Because of sweating, take away. Most people sweat between the legs when they're exercising or on a hot day. For some, the moist, sticky feeling in the groin persists all day long. Extra showers, careful drying, and wearing natural fabrics are only some of the ways to deal with this. If the recommended treatments don't work, it's time to get help, even if you may not feel comfortable talking about your sweating. If sweating interferes with your daily life, including work or your relationship, see a healthcare provider. Let them know if you notice other symptoms along with sweating.